Hi, good evening. Thank you so much for joining us tonight. Our main kind of topic of conversation is the COVID vaccination programme, as promised. I had to be able to do that, so let me just move on to our next screen. So as we've said, okay, from our Q&A meeting that we had back in November, we would meet with you every fortnight. It's great to have so many of you already on the call. I think we're just short of 100 at the moment. So hopefully you'll find this a useful 30 minutes. And again, to just recap, the purpose of this meeting is to update you on the latest information that we have about the COVID vaccines programme. Now, bearing in mind, things are changing every second, it feels like right now. So bear with us, because even though we're live now, we may be being told more information that's different to now. But this is all about what we know now, what we are going to do. So in the current kind of climate that we're in. Okay, last time it was myself and Dr. Chet Sheth from Serum Health Group, but tonight you've got myself again and Dr. Ian Green from Avon Valley. So we're just going to have him give you a little wave.
Good evening.
Let's move on to this. So what we know, as we said last time, patients are being prioritised and we have various different cohorts. Now, cohort 1, and that is those people aged over 80, health and social care workers, and those people who live in a residential home who are under 80 are in cohort 1. And then we know that the cohorts typically go down in 5-year age groups. So cohort 2 is 75 to 80 and so on all the way through. OK, we also know that there is a national call and recall system for inviting you to book an appointment. OK, so you will receive what we are told is a letter from the government recommending that you are, well, that you're entitled to one of these vaccines and to book an appointment. And you will be offered an appointment at either a mass vaccination centre, and we are told that there will be one in Salisbury, or indeed at a GP practice hub. And this is where GP practices have to work together in groups to be able to deliver this vaccine from one site, because we are only talking about the Pfizer vaccine at present, and it's very, very fragile. We are not even allowed to walk up some steps or down some steps with the vaccine. OK, it must be kept on the level. You're not allowed to shake it. You're only allowed to massage it, let's call it, as you tip it around to dilute the vaccine. OK, so this vaccine is fragile. It needs careful looking after. And we were instructed by NHS England to be ready to deliver this vaccine from the 1st of December 2020. And indeed, we are pleased to tell you that actually our site was approved, and our site will be at Lark Hill. So it's in the new premises that Serum Health Group moved into on the 1st of April 2020. It's got 9 consulting rooms, large waiting area, and lots of parking. So we're able to ensure that you are able to socially distance whilst also obtaining your vaccination. We can't really talk about the AstraZeneca vaccine at the moment, just because we don't have sufficient information about when this vaccine may be available. But we are told that it's more portable and not so fragile as the Pfizer one. OK, now, before we can go live and actually start administering people, the NHS England delegate a responsibility to what's called our clinical commissioning group based in Wiltshire, RCCG, to come and do a quality assurance visit. And that's just making sure that we've got everything ready and it's as safe as it needs to be to ensure that this vaccine can be administered to you as safely and effectively as possible. OK, so at that moment in time, I'm just going to have a look at the questions and see if there's any about the cohorts. Now, just while I'm having a look, I'm going to pass over the video over to Ian. So Dr. Green, this is so that he can give you a wave and you know who you're talking to.
Good evening, everyone.
Hi. OK, great. So here's some questions about the cohorts. So I'm a living carer working with a person over 80. Can that carer be vaccinated? And the question, the answer, unfortunately, is a no. It is only people in cohort 1 who are being vaccinated at the present time. OK, and then the government will decide when we move over and start vaccinating people in cohort 2. That is the directive, and we're not allowed to stray away from that. So anybody who is not aged over 80, anybody not in a nursing home who's under 80 or not a health and social care worker, they will not be vaccinated yet. They will be in a different cohort. OK, so in terms of answering those questions, to be able to do that, I think I've kind of collectively done that in terms of those things. Now, somebody said, what if you don't get a letter? If you don't get a letter, that probably means that you are not in cohort 1. However, if you are over 80 and don't get a letter, please do tell us. OK, we will still offer you an appointment to book in to be able to do that, and we will do our own kind of invitations to people through text messaging probably to be able to contact those people so that you are aware of that, just in case things get lost in the mail. OK, but we will have to see how that goes in terms of the time frame in which we are told when the vaccine is going to come and be delivered to us. So I'm just going to move on to that bit, because there's quite a lot of questions about when and where will the vaccines commence in our area, how soon will people get vaccinated. OK, so I'm going to move into that area now in terms of those things. So as I said at the very beginning, our site has been approved as Larkhill to be able to deliver or administer vaccines to patients from our site in Larkhill. OK, now the time frame of when that will actually happen is mandated by the government. Now there are a few GP practice groups in the area who went live tomorrow, sorry, they go live. So for instance, some people in Devizes are receiving the vaccine tomorrow. That has been decided by the government based on the population. So our population with our group, we only have 732 people, OK, who are in cohort 1. Therefore, we're on standby that actually they're only looking at groups at the moment with a larger number of people, but we are ready to go as soon as NHS England push the button and say, we want you to start delivering or administering the vaccine. We do have a few logistical problems, and that is that at the moment, the government are only confirming the time of which the vaccine is going to be delivered within 24 hours. So potentially we've got to be very careful with our appointments, because we need to vaccinate and use all of that vaccine within 3.5 days of the vaccine arriving. And at present, we're giving very little notice about when that vaccine will be delivered. So it's going to be quite tricky to get those appointments booked. But we are trying our best to organise for the vaccine to come to us between kind of a Wednesday lunchtime and a Friday lunchtime, so that we can deliver this programme to you on a Friday, late Friday afternoon, early evening, and through all day on a Saturday. And the importance of that is to ensure that we can continue to deliver healthcare normally Monday to Friday, because this COVID vaccination programme is really important. It's crucial that we're involved in it, but we also it's really important for all of you to continue receiving healthcare about all the other issues and concerns and worries that you all have, and your maintenance and monitoring throughout that time. So we need to balance all of those things together, and we feel that offering the vaccines on a Friday afternoon, early and evening, and a Saturday enables us to continue operating Monday to Friday, OK, as well as delivering the vaccine to you safely and promptly. So that's what we're working on, OK, to be able to do that. We also know that we're going to be recording the information on a system called Pinnacle. And I only tell you about this because it's not going directly into your medical record at the moment of which you have the vaccine. It's going to go into a system called Pinnacle. And that system's been used by pharmacies to record your flu vaccines when you've had them in a pharmacy environment over the last couple of years. And they're going to use that programme for us to be able to record your vaccination. And then at a later point in time, that information will be extracted out of Pinnacle and put into your medical record. OK, at which point you will be able to obtain that information if you have online access to your medical records to see that that vaccine has been administered, to be able to do that. OK, so that's the way in which that works. Now, today I was on a call this afternoon, finished about 4 o'clock, to say that we will be getting our vaccines in January. They won't give us any more dates than that, but it will be in January. OK, so we will look to set things up to go live from that first week, just in case. So that will be the 8th and 9th of January, just in case we do get that vaccine, because as soon as we get told we can, then that's what we'll do. OK, but we are balancing that with making sure that we can deliver you the right healthcare Monday to Friday as well, accordingly. Now, what I thought might be quite interesting is for you to understand the flow that will happen when you come to the surgery for your vaccination, because it's important to be prepared to be able to come in. OK, because potentially you're going to be invited at the last minute. It will feel like the last minute of quick, we've got this vaccine. And I apologise for that now. However, we cannot find a way around that at the moment with the short notice that's being given to us on when that vaccine will arrive. So when you're kind of preparing from home, it's to make sure that you've been to the toilet and you wear preferably, say, a coat with a short sleeved top underneath, so that you don't have masses of layers to have to take off whilst you're waiting for the appointment with the clinician. OK, so you're going to walk into the building, and you'll first of all meet a non-clinician, OK, who will do the COVID screening, very much like you've had when you came in for your flu jabs, for those of you who have attended this year. OK, so you'll get COVID screening of temperature check and screening questions. You'll then go through to reception, who will book you, as in you've arrived for your appointment, and you'll be issued a consent form. OK, you will also on that consent form have the medications and allergies that have been recorded in your medical record. And we'll talk about the allergies with Dr. Green in a little bit, about those things to be aware of. Once you have been given that consent form and a list of your medications and allergies, you'll be asked to take a seat and watch a video about the vaccine, so that you're told all about the side effects, what will happen and how that vaccine will be administered to you. You'll then move to a clinical room and you'll sit in the doorway, again, very much like flu, OK, and you will pass over the consent form with those medications and allergies to the clinician. Now, at this point, I have forgotten to mention that, of course, you will hopefully have signed that consent form, but it will be checked by the clinician to make sure that you are happy. Having undertaken those kind of verification of information, then of course we will administer the vaccine to you and record that vaccination on Pinnacle about you to be able to do that. OK, you'll be issued also a kitchen timer. I know that that sounds a bit random, but that will basically count down the 15 minutes of which you need to stay in the practice premises, just in case there is an allergic reaction. And you will be asked to move from that clinical room to a holding bay, again, all socially distanced, OK, and there will be a non-clinician and a GP on duty there, just in case something was to happen, to make sure that you're OK. And when your buzzer goes off, there you are, you're able to leave the building, you'll hand your kitchen timer back to the marshal who's on duty, and you'll leave via the fire exit. So you need to be prepared to be with us for about 30 minutes, roughly, to be able to do that, OK? And bearing in mind, you've got a little bit of a walk to the surgery from the car park and a little bit of a way back, that actually, if you kind of prepared accordingly for that, I think that that's reasonable to be able to do that. So that's the flow that will happen on the day, so that you know what's happening. So again, like I just said in prep, if you can go to the toilet before you arrive, that's great. If you can wear a short sleeved top underneath your coat, again, that's great. Don't forget your face mask. I take that for granted now that we all have to wear them all the time. So make sure you've got your face mask. And also, we are looking to make sure that you bring some ID with you. The reason for that hasn't been confirmed exactly yet in terms of a governance point of view, but we're considering to make sure that we know that you are the person that turns up for that appointment, to make sure that everything is sound, because we do know that this vaccine is going to be very, very popular. It has a very high street value, and we need to ensure that only people in cohort 1 obtain that vaccine. OK, so I'm now just going to move over to Dr. Green to ask him to talk about the allergies.
As far as allergies go, the only definitive advice we've been given so far is for those people who have had a definite anaphylactic reaction. And if they've had an anaphylactic reaction to anything in the immunisation with the first one, then obviously they won't get a second one, but we won't know that first time round. So anyone with a confirmed anaphylactic reaction or who carries an EpiPen are the groups of people who would need to be individually assessed for the appropriateness of the vaccination. If you have a mild allergy, then those people are fine to go ahead.
Thanks, Dr. Green. So we've got another question here. Will two people in the same household, both in their early 70s, be invited at the same time to receive the vaccine? Yes, we are told that they will be to be able to do that because you're in the same age bracket to be able to do that. However, that is 70 to 75. If one of you is 76 and one of you is 74, then you will be in two different age brackets. So again, there's quite a lot of questions of when will we start vaccinating, and I hope I'm kind of answering that kind of clearly enough that it will be from January, okay, to be able to do that. Now, okay, here's another question for you, Dr. Green. Given that today there is a new variant of COVID-19, is there any information as to whether the Pfizer vaccine is equally protective?
Not that I'm aware of. If there is a new variant, then I'm not aware that we will cover that. So time will tell, I guess, whether the vaccination that people are giving will actually cover the new one or any future new ones.
Great. So again, somebody has had, how will anyone with allergies be dealt with? So Dr. Green, have you got any kind of advice about what happens if you have got an allergic reaction?
As already said, I think if you've got allergies, then either speak to one of the clinicians at the practice if you're that concerned, but primarily it is those people who've had an anaphylactic reaction that are the ones that we really need to be thinking carefully about who we give the vaccine to or not. And it will be, it's got to be assessed on an individual basis if we know exactly what the allergy is to, but if it's an unknown allergy, then I think that would cause more concern than if people have a recognised allergy to certain things.
Hi, great, thank you. So the next question, as the vaccine is so fragile, how will we know that the dose we have received is viable? Well, we have very clear standard operating procedures that we will have to follow. So we will follow those to the absolute letter to ensure that we look after that vaccine appropriately to be able to do that. So that's our reassurance. We will make sure that we do everything that the government is insisting that we do to ensure that we keep that vaccine safe. So for instance, we will not be walking up and down stairs with it. We don't need to, so there's not even a risk of that, but that would be one of the things that had we got stairs in the building, we would have to make arrangements to ensure that that didn't happen and take extra staff training to ensure that doesn't happen. There's another question here. For people without transport, will we be able to have the COVID vaccination in Salisbury? Yes, you will. That will be at the mass vaccination centre. And we've been told again, last week, that the mass vaccination centres in Wiltshire will go live in January. So we've been told in the new year, I'm going to use January for that, okay, for those mass vaccinations. So if you want to receive it in Salisbury, then absolutely you can. You follow the instructions on the letter, and therefore that's how you'll be able to book an appointment at that centre to be able to be vaccinated locally, to be able to do that. Somebody else says, a relative over 80 in Ipswich was contacted by text, not letter, so what is it for us? Well, this is where the government has told us it's a letter. Now, if they choose to use a text message service because they've got the mobile number for that particular person, then I assume that they will use it. However, we've been told it's a letter. So bearing in mind that can change, I understand that. However, that's what we've been told at the moment. So like I said, we can only tell you what we've been told. Yes, makes perfect sense to be text messaged. I agree with you. However, I can't tell you which that is going to be because we've only been told it will be letter. Okay, so the next one is, I'm a global healthcare worker and travel internationally for my profession. I will need to be vaccinated in order to do my job, but I'm concerned that I will not be offered the vaccine. I also understand that this will not be in the next month, but need to know when it's likely to be. Okay, now in terms of vaccinating healthcare workers, we've been told that employers of healthcare workers will be contacted to invite their staff for the appropriate vaccination. Now, so therefore, I would go to your employer about that and find out what they've been instructed as a healthcare profession to be able to do that. In terms of when, like I've said, we are not vaccinated until January. There is discussion that there may be an opportunity for for a small cohort to be vaccinated in Salisbury later next week. However, that's not been confirmed yet, and the site has not been finalised, from what I understand, ready for action. But again, things move very, very quickly, so that may happen. But like I've said, the mass vaccination centre is not ready to be able to go live this side of Christmas. It will be in the new year. We've got another one. What if you're in group 1 but have severe allergies? Will you still be able to have it, or will you be prioritised when the next appropriate one comes out? So I assume that means about AstraZeneca, and yes, that's what we know at the moment. But again, we haven't had the finalisation about AstraZeneca as yet to know what the allergic reactions may or may not be. I'm going to just check and look at Ian, Dr. Green, just to check whether I've answered that properly. Yes, he's nodding his head. So yeah, I've said the right thing here. So will you have a reserve list of people to vaccinate, to ensure a reserve list of people to ensure that you don't waste any vaccine that hasn't been taken up each week? Yes, we absolutely will. However, again, like I say, we've been told that we are only allowed to vaccinate in cohort 1. So if we had any vaccine left over, then we would need to contact NHS England, who would then direct other services to invite patients or other healthcare workers to obtain the vaccine from us. So someone said, what form of consent will be necessary for those with dementia? So that's actually in best interest. I'm just going to ask Dr. Green here to update us on that in terms of regard to people that perhaps don't have mental capacity to give consent.
Yeah, I think that would be the same as with the flu, really. It'd be done in their best interests, making that decision. So
great. Okay, so somebody's asked, why is verification of ID is needed, as the surgery already holds this already? Now, this is where we will be booking you in terms of on our clinical system. However, we're talking about a lot of patients arriving all at the same time. And we do know, because we've had this before, whereby patients have given the name, date of birth and address of somebody else, okay, to try and get some level of healthcare. Okay, we can't allow that to happen. Okay, so we must take every level of safeguarding that we can to ensure the person that stood in front of us is the person that is entitled to that vaccine. So although it takes like an extra step, it's one of those things that we wouldn't want to vaccinate somebody under a different name and then find that that person turns up for a vaccine and say, but hang on a minute, you've already had it. So we need to avoid that kind of situation. Again, I do agree it's quite unlikely, but it's one that could happen. And if it could, we need to consider how we mitigate that. Somebody else has said, I cannot stand for any length of time. Will that be a problem? No, indeed, that shouldn't be a problem. You will be moving or sitting on the chair watching the video, so that shouldn't be any issue at all. So we've got another one. Where is the new centre coming from? Uphaven. So the new centre, so we will be looking to vaccinate people in Lark Hill. Okay, again, in the letters and the information that we send out to you, we will be giving you the address. Indeed, if you Google Sarum Health Group, and you can find the map on their website that shows you exactly where the medical centre is. But indeed, you drive through Lark Hill with Durrington behind you. Okay, you drive down that road, down the long high street, and you'll see the building on your left-hand side. It's huge, you can't miss it. It's just opposite the Sharps Hall. And you turn left down Willoughby Road, turn left again into the giant car park, and either through the steps or along the path all the way into the building. So is there an opportunity for vaccination for people travelling abroad? Not at the moment. It is, again, all in terms of in the cohorts. We are only allowed to vaccinate people in cohort 1. And that, so if they happen to go travelling as well, that's a bonus. But other than that, there won't be there's not scope to vaccinate anybody just because they're going abroad. It is based on risk factors. So somebody said, can I accompany my dad when he goes through the process of having his injection? He is hard of hearing and uses a mobility scooter to get around. Yes, you can. Depending on the number of people right there and then, we may need to ensure that there's enough spacing to maintain social distancing. But yes, we would expect you to be able to support your dad through that. So somebody else says, what happens if you're on holiday when your vaccine is due? Well, indeed, at the moment, let's hope most of us are not going on holiday right now to be able to do that. But I think that there will be a lot of government press in terms of the cohorts of which are being invited to vaccine. So you should be made aware of that, even if it's through the press. If you've still got your mobile phone on you, we will still text you to remind you of that need to be able to do it. And I assume that you will be able to catch up at a later date. However, I can't guarantee that because I just don't know. So I can't make a promise. I can't say yes and I can't say no about that because I just don't know. So I'm really sorry about that. Somebody else said, I am 81 and the lady I live with is 91. Do we both go in together? Yes, you will be able to book an appointment side by side. You will not go into the same clinical room together. You will go into different rooms, but it's likely that you'll be next to each other in 2 clinical rooms next door to one another, but you won't be actually waiting with each other to go in, purely because we need to vaccinate each person as efficiently as possible. Again, somebody said about having people in reserve, and yes, we will. We will be contacting people who don't arrive for their vaccine live as we go, and trying desperately to get hold of people saying, quick, we've got a space, get in, to be able to do that. We'll do everything we can do. Can I say that we'll use all of that vaccine? Then we'll try our very best, because we do not want to waste a single drop about this. However, we have to be aware that this vaccine has to be used in 3.5 days, and if we're not able to use it in that period, then it will have to be thrown away. But we will try our very best to ensure that it is all used. So here, Dr. Green, we've got a question for you. Can you still have this can you still have the vaccine if you have already suffered from COVID and no longer have antibodies? Is there a risk of further complications?
Yes, you can. There's no evidence that having had previous COVID infection increases your risk of complications from the vaccination. If it was a while ago, that's fine. We wouldn't be vaccinating anyone who'd had any recent infection or temperature. We want them to recover from any minor illness, even a cough and a cold, as well as potentially a recent COVID. But if it was a while ago, then that's fine.
So somebody else has said, an elderly friend has not yet had a flu jab. Does that prevent her from having the COVID-19 vaccine? No, it doesn't. But what we have been told is that if you've had the flu vaccine within the week of attending for your COVID vaccination, that you'll be advised not to have the vaccine at that time. So it's a 1-week window of having had the flu vaccine, not anything to do with whether or not you've had it before. OK, in terms of that flu vaccine. Somebody else said, how confident are you that the letters will arrive on time? What to do if the letter arrives after our appointment time? Well, that's where we would try and text message everybody to do what we can do as a practice and a group of practices to get hold of you. What I would say is start getting prepared. If you can give us a SMS consent now, then we'll be able to send SMSs to you. So if you haven't given us consent to contact you by SMS, and you do have a mobile phone, and that's possible, then we would really recommend that you fill out our communication declarations to be able to allow us to contact you about this. So that's a kind of bit of work for preparing, getting ready in the next kind of 3 weeks so that we can contact you nice and quickly. It also will help when we're trying to get hold of people to come in at short notice. Being able to text people quickly should kind of help us get hold of people as quickly as we can, and to them in terms of as many people as we can. So Dr. Green, another question for you. Is a booster necessary? Exactly how long after the first vaccination, and what happens if someone can't get to the vaccination centre during that time window?
Pfizer vaccine needs a booster 3 weeks later, which I believe is necessary, but it's 3 weeks plus. So not any sooner than 3 weeks. If you can't get there for the booster at 3 weeks, then after 3 weeks would be absolutely fine. Obviously, the sooner you get it, the quicker you're fully covered, but I think that booster can be given any time after 3 weeks, the sooner the better.
Hi, yeah, we've been told 3 weeks ideally, but we can go to 4 weeks. So that's what we'll be looking to do at the moment. That's based on current guidelines. So somebody said, so I missed the first few minutes. When will the letter for the 86-year-olds be sent? We don't know the date. We just know that we have been told that we will be starting to vaccinate people in January. We're getting our workforce ready to be on standby to be able to vaccinate on Friday the 8th, Saturday the 9th, and so on going forward to be able to do that. And we expect that the letters will be sent by the government after that date once they've confirmed what we're doing. Now, that's all we've been told. Whether or not that happens in a timely fashion, I don't know, but I do know that other people in the country have received letters that have started vaccinating last week. So, you know, fingers crossed that that works, but we will do everything we can to contact you as well with as much kind of as the capacity and the demand that we have to deal with it at that moment. We've also got, will there be a wheelchair available? Yes, we do have a wheelchair. However, what we would say is that if you have got access to a wheelchair, to use it yourself, okay, to be able to do that, because we do have to be prepared for medical emergencies that may take place with allergic reactions, and it would be a disaster having the one wheelchair that we have to be used by someone else, and we need it for someone else in a medical emergency as well, whatever that may be. So if you need a wheelchair and you have got one, please bring it with you. It's completely accessible, the site, to be able to do that. So please use that, bring your own if you can. Someone else says, when are the first letters being sent? My 84-year-old granddad hasn't had one yet. No, he wouldn't have done because the vaccination programme here hasn't started. Is the session being recorded? Yes, it is, to be able to put it on our online on our website later on this week. When will the second wave of cohorts be called forward? I don't know. They're trying to vaccinate as many people as quickly as possible in the country, but like I've said, it is based on cohort. What group do the extremely clinical vulnerable fall into, and when would we have the vaccine? Again, it all depends on your age until you get to aged 18 to 50, and then you get brought forward before people who are 45 to 50, because you're deemed at high risk to be able to do that. But if you are older than 50, then you'll be brought in or invited in to your cohorts. So somebody else has said, will we have a choice as to which vaccine? It is said that the Pfizer one appears to be more effective. We will get told by the government which vaccine we are delivering, and at the moment it's the Pfizer one. Dr. Green, another question for you. It's about long COVID sufferers. On the basis that this may be an immune response, would the practice recommend that its long COVID patients have the vaccine or not?
Yeah, the guidance at the moment is that long COVID patients should have the vaccination.
Thanks, Dr. Green. OK, and then it also says, will people with very limited mobility be able to have it in their home? The Pfizer vaccine cannot be delivered to people in their homes. They have to come from central sites because of the fragility of the vaccine. So at the moment, that isn't available. However, it's believed that the AstraZeneca vaccine is more portable and may be given to people in their homes, but we don't know that yet for sure. OK. And the last one, will we be given a certificate to say we have had the vaccine? You won't on the day. It will go into the Pinnacle system to be able to do that, and it will get transferred into your medical record. So if you can get access to your medical record online, you'll be able to obtain that information whenever you need it. So that's what we know at the present time. Now, we've got lots and lots of questions, and I've tried. OK, here's another question for Dr. Green. If you react badly to the vaccine and you're not allowed the second one, will you be able to have a different one?
Yeah, I would assume you would. We don't really know, but obviously if you react badly to the first one, you're not going to be given the booster, so presumably you won't be fully protected. And until we get some guidance on the other vaccines, it's difficult to know whether they would be appropriate or not. So I think we just have to wait for further information on that.
Hi, Dr. Green, another question. What should I do if I'm trying to conceive?
So all of those younger patients maybe who are trying to conceive, actively trying to conceive, or are pregnant or are breastfeeding should not have the the vaccine at the moment. So it's one of the reasons not to give the vaccine.
Okay, fab. And another question, my elderly mother had a bad reaction, Dr. Green, with the flu vaccine a few years ago, kidney issue. Should she still have the COVID vaccine? I don't know, we were expecting you to go to Dr. Green. Is that happening? Oh, there we are.
Yeah. I mean, I think you'd have to have a look and be sure that the issue with the kidneys was related to the flu vaccination, but a reaction to a previous flu vaccination is not a contraindication to the COVID vaccination unless it was an anaphylactic reaction.
Great. Okay, so we've actually overrun by 10 minutes here, and I've just quickly gone through the questions, and I think indeed we've answered all of them in terms of that. Either, oh, hang on a minute, sorry, it's only just come to me there. It's been a bit of a delay, isn't it, tonight? The data system isn't working very well, but there we are. I'm really sorry about that. So indeed, what I was just saying is that we've 10 minutes overrun. But I hope that we've answered all your questions. There are a huge number of them. I've tried to type responses where possible, where we haven't actually answered directly. But in terms of those, I think that we've answered them all. OK, if it hasn't, please stay logged in and I will try and answer more and more of them as we go to be able to do that. So I think we've covered all the ones about the allergies, conceptions and the access in. So thank you again. OK, now depending on what we find out, we may be running one next Monday if things change quickly. In that period of time, we have more information from you, but no news means we have nothing more to add, OK, at the present time. We will, however, set another meeting up for the 4th of January, that first Monday back in, to find out whether we've got a date. And indeed, if we get a date sooner for start time, then we will ensure that we run one of these meetings and we'll send text messages out to everybody to say, log in, get going, let's do this to talk these things through. So thank you so much for joining us tonight. I hope you found it useful. Yeah, and again, have a nice Christmas if we don't talk before. Many thanks. Bye-bye.